Hello, everyone. My name is Dr. Aaron Styer, a physician here at CCRM Fertility. With the current COVID-19 pandemic and all of us trying to social distance as possible, uh, work from home more, minimize our risk for exposure and infection, the time is now to take control of your fertility and be as prepared as possible for when we can resume fertility treatments. Today, what I will do is review recommended supplements and lifestyle modifications for those who prepare for fertility treatments. Now, the two most common questions I've got in my career have been, number one, how can I improve my fertility ability to conceive now? And number two, how can I extend my fertility for several years to come? And this really is based upon a combination of a couple of different factors, including genetics, nutrition, as well as wellness. From a nutrition standpoint, it really comes down to supplements as well as dietary factors. And I have to admit, from a supplement standpoint, this is probably one of the more confusing and frustrating things for patients who are trying to be proactive, because there's so many different advertisements out there about the best fertility supplements, different books with different conclusions and recommendations. And also we have our own friends and family and colleagues who give us their own recommendations as well. So I try to make this as straightforward as possible. I look at it in two categories for supplements. And that includes foundation supplements, those that you would take even if you weren't trying to conceive. And these basically take care of the basic cellular functions the body needs daily. And the other category is going to be antioxidants, which essentially take care of the address the wear and tear and strain on cells and to keep them healthy. And have recently possibly shown to have some fertility benefits in some studies. Now, looking at the foundation supplements initially, the first one's going to be prenatal vitamins or multivitamins, interchangeable here. In terms of what they either one, what they require is going to be really 0.4 milligrams or 400 micrograms of folic acid. Folic acid is important in ensuring that there's normal organ development in the baby during pregnancy, and also to reduce the risk for neural tube defects. The second supplement in this category is going to be vitamin D. Now, vitamin D has been something we see mainly in regards to bone health and reducing osteoporosis or brittle bones. But interesting enough, we actually make a modest amount of vitamin D in our skin following sunlight exposure. But we see that there is a fair amount of us who are vitamin D deficient. And so we really have seen that optimizing vitamin D levels can improve fertility in some studies and also optimize pregnancy outcomes in patients as well. So we recommend 1,000 to 2,000 international units of vitamin D orally per day. Here at CCRM, we actually test vitamin D levels prior to treatment. And so if these levels are lower, not where they should be, we replace them and ensure that you have the best levels and the best pregnancy outcomes prior to treatments. And the final supplement within the foundation group is going to be the omega-3 fatty acids or fish oils, also known as DHA or EPA. These have been shown to have great benefit within the cardiovascular heart health or heart disease arena over the past 20 years. We've also seen they have incredible anti-inflammatory properties and to benefit women who have endometriosis and adenomyosis in some cases, those who have fertility, but also those who have Crohn's disease, ulcerative colitis, and other autoimmune disorders, especially those who have exaggerated immunity that may impair the ability to carry pregnancy or to become pregnant. Typically, we recommend 1,000 milligrams of this per day as well. Now, the second category I mentioned, the antioxidants, are headed up firstly by vitamin C. Good old vitamin C, 500 milligrams to 1,000 milligrams per day. It also has great immunity boosting properties as well. The second medication or supplement in this category is going to be coenzyme Q10, something that's really garnered a lot of attention over the past 10 years for its great results in animal studies showing that it can have beneficial effects on egg reserve and egg quality and the number of eggs contained in the ovary. So we typically will recommend 400 to 600 milligrams per day of this supplement. And then finally, acai. Acai is a berry derived from a South American palm tree. This antioxidant has been shown to have probably the highest concentration of antioxidant properties of any other things I've mentioned previously. and has been shown some benefits in some fertility studies to improve egg yield in IVF and also possibly fertility outcomes and pregnancy rates. And so this is best administered or taken in powder form or frozen thaw form. So something more to investigate and see what develops as we go forward. And then besides these supplements, we always think about lifestyle modifications. So firstly involves really having a well-balanced diet, macro and micronutrients. Also sleep is something we all underestimate and undervalue, about 7 to 8 hours sleep per evening. Also avoiding tobacco use and vaping, minimizing caffeine use. Meditation is something that we've seen as another great adjuvant intervention here, 5 to 10 minutes per morning prior to starting your day to reduce stress and anxiety. And finally, acupuncture is something that when we have less restrictions on person-to-person contact is something that we really highly recommend here at CCRM. Now, looking at and just kind of recapping everything here, want to get into number one slides here, foundation supplements. So again, prenatal vitamin, chewable or tablet form, 0.4 milligrams or 400 micrograms folic acid, vitamin D or vitamin D3 or cholecalciferol, 1,000, 2,000 international units per day, omega-3 fatty acids or DHA or EPA or fish oils, 1,000 milligrams a day of this. Antioxidants, vitamin C, 500 milligrams per day, can sometimes be in prenatal vitamins, so just check the label. Coenzyme Q10, 400 to 600 milligrams per day, can also be referred to as ubiquitin on other forms, so don't be confused here. Very similar efficacies. And then also ISA-E, which is also a promising agent we've seen in some fertility studies, and also dietary supplementation as well. Now, there are other supplements that many of you may take, which have not as convincing benefits in studies, but I'm going to mention them anyway today for completeness sake. Inositol for those who have polycystic ovarian syndrome, which we've seen can facilitate weight loss and also improve glucose metabolism. Also L-arginine, magnesium, zinc, selenium, melatonin, as well as DHEA. I want to note with any kind of medication, whether it be supplements or other medications, you should please check with your primary care physician to ensure that there's no concerns for allergies or interaction with your current medication regimen. And then finally, lifestyle modifications. Again, fairly common sense things, but I think good to really bring up, aerobic exercise, well-balanced diet, adequate sleep, meditation, avoiding harmful things, tobacco use and vaping, minimizing caffeine use and acupuncture as well. So I want to thank everyone for joining me today. I want to wish you all really the best of luck in your fertility journey. I wish you all to be well and healthy. We're with you through these very challenging times, and we'll make it through stronger than when we started. And again, please reach out to us if you need anything from CCRM. Be well and have a great day. Bye-bye.